For this video, I'm going to show you how to apply a muscle energy technique and a manipulative maneuver for the dysfunction of the pubic symphysis joint. So this joint in here, so if you've got the two pubic bones, and actually we've got this cartilaginous joint in between, along here, typically according to Greenman has a book called The Principles of Manual Medicine. He basically says you can either go inferior or you can go superior. So you can focus on whether it's gone downwards or upwards. So you can literally just use one side or the other side. But then this one is a simple correction for this joint in here. So if it's gone up on one and down on the other, or vice versa, then we can do this technique to realign and reset this position in here. Not everybody gets pain anteriorly. Some people will get pain posteriorly. So almost like an SI pain. Because if it's a three-dimensional bowl, if it's out on the front, you could get pain on the back. So you might not present with pain here. I remember once there was a chap in the bobsleigh team, and my friend was looking after him, and as he pushed the bob, he felt something tweak within his groin. And then when my friend looked at him, he said the symphysis wasn't sitting right and did this technique. And then he retested after the technique and he had no pain. So I know that it works very well. Ladies, you have to be a little careful. Pregnancy, because of a relaxing hormone circulates around the body, it can stay in your system for a year or so afterwards. And if you've got pain after giving birth within this area, then you might have to wait a few weeks before you have the correction technique. If it's a natural birth, naturally it's going to be less, yeah, but you have to wait compared to maybe a cesarean, where you might have to wait about 3 months, okay, for the internal stitches to heal before you try these techniques. Okay, so let's move on with the maneuver. So what we do, the patient is in this position here, and the knees are bent, and I normally put their feet together. So one of the methods would be hands either side of the knees, and then I'm going to ask my patient to simply take the legs apart. So open your legs, that's it. So he is abducted. I don't say how much, I just normally resist. If he's pushing too hard, I'll probably say back off. But so normally for about 10 seconds and relax. And we do it 3 times. Push again, please. So he is pushing to abduct. And 10 seconds. And then once more, take the legs apart. Now, so the idea is as he's abducting, it's telling the adductors to relax through inhibition. One technique before we progress to, say, a thrust would be simply place your hand between their knees and ask a patient, can you squeeze my fist, please? So squeeze in tight, tight, tight. And for some patients, you might feel a cavitation around the joint, but not for everybody. Just by squeezing, sometimes it will release that area. If it doesn't work on that technique and you believe it still needs to be done, then we go back to the abduction. Take the legs apart, please. So he is abducting, again for 10 seconds. And after the 10 seconds, I then place this hand on this knee, this hand on the other knee, take the knees a little wider, go to squeeze in, tight, 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 and as he squeezes in, it's a quick separation of the legs as the patient is contracting. So watch again, so they go to squeeze in tight, tight, and then you separate. And for some, they will have a cavitation. The idea of a technique is that as they are contracting concentrically to shorten the adductor, you quickly separate, which then causes like an immediate stretch from the ramus of pubis, which then opens the symphysis joint and then allows it to realign. Okay, and they call it the shotgun technique because it can sound very loud, as in the shotgun noise, when you have it done. Okay, so just be careful, but it can be quite noisy if you have this done to the patient and you haven't pre-warned them the effect it might have. So that's an MET into a thrust for the symphysis pubis or pubic symphysis joint. Thank you.